animals and the environment they share are intrinsically linked. So we're going to talk more about the One Health approach. I wanted to also acknowledge and celebrate the fact that the School of Veterinary Medicine here at UC Davis is celebrating its 75th anniversary this year. And that's given us a chance to really look back and appreciate the fact that the school has been at the forefront of the whole field of wildlife medicine, whether we're talking about captive wildlife or free living wildlife. UC Davis School of Veterinary Medicine has really been a leader in the field. And so I speak for myself, but I think we all feel really fortunate to be working here at the school and the Wildlife Health Center, and also, of course, appreciate the fact that we have the privilege of working to lead the Gorilla Doctors program. So we're going to talk more about Gorilla Doctors. We're doing things a little bit differently this morning compared to Gorilla Doctors live events in the past. We're not going to have a bunch of videos and photos. You're going to hear lots of talking between us, but more importantly, hopefully lots of talking with you, because we're going to make sure we have a lot of time at the end of the session for you to pose questions, and we'll do our best to answer as many as we can. So some housekeeping, just in order to give us your questions, you need to go down to the bottom of your Zoom window and you'll see a little question and answer button. Just click that and enter your question. I'll be reading them when we get to that point of the hour together, and please give us your name and where you're from. Okay, so with that, I would like to introduce my colleagues. I'll start with you, Dr. Tierra. You're the newest member of our team. Dr. Tierra is our Chief Veterinary and Scientific Officer, and she has a long and fun history with Gorilla Doctors, so I'll let her tell you.
Yeah, thanks. So I'm the newest member, but I've actually been working with Gorilla Doctors in various capacities since about 2007, I think. I've always wanted to be a veterinarian, probably since I was 4, I think. But when I was a first-year veterinary student, I had the opportunity to spend the summer with Gorilla Doctors, and that's when I got to know a lot of my now colleagues and learn just exactly what they do every day and how fascinating and challenging their day-to-day work is. And so that really kind of set me off on wanting to work with great apes and solidified my career path. So when Gorilla Doctors was moving their academic institution to UC Davis, I kind of followed them out here.
You did.
And did my PhD in collaboration with Gorilla Doctors here at Davis. And so kind of part of the project I was working on was really seeing how we could make these veterinarians really challenging work a little bit easier. So I was trying to see if we could get more information out of easier to collect sample types. So actually chewed plants was what I was working on. And when that research finished, there was not a giant list of grade 8 positions at the end. It's a really unique field. So I worked on other wildlife. I worked on Asian elephants and gibbons, and was just kind of sitting around hoping that this position exactly would become available. And about 6 months ago, that happened. So I'm really happy that I was selected and just ecstatic to be here.
Yeah. And actually, when you, if I recall, when you were doing your field research for your dissertation, when you went over to do all of that sample collection, Dr. Noel had just joined our staff as well. So,
yeah.
So you started in your position in January, and you went right over to the region almost right away.
Yeah, I was excited to see everyone again, and it was a really nice opportunity to bring all the veterinarians from the 3 countries where we work, in Uganda and Rwanda and DRC, to our regional headquarters in Rwanda, and have a strategic science planning session. So it was a great couple days where we got together, and I got to hear from everyone who's been doing this work for a very, very long time about exactly what they wanted to see in a science strategic plan, and what they are most passionate about and what they want to work on most. And so that was really the goal of that meeting, was just to bring everyone together and to get all of that down on paper so we could start to distill it into our work plan basically for the next.
That's great. I'm glad you brought that up, and I know I want to come back to our science strategy, because it's really kind of a major effort of ours right now. We're really excited about where it's going to take us. I think in past Gorilla Doctors Live events, we've focused a lot on the life-saving veterinary care that we provide to our gorilla patients. And in fact, Noel was a field veterinarian for about 11 years in Rwanda, but he's here at UC Davis right now. So I'm going to let you tell them why you're here at UC Davis.
Well, thank you. I'm here studying or being trained in pathology. As you said, I'm still a field veterinarian with the team, but I'm in Davis now training in veterinary pathology, the subject of my dream. So of course, my feelings are very much mixed because I miss being on call 24/7.
You miss it?
Yeah, yeah, and of course I miss my family and teammates. But the reason being here also gives me the reason to kind of soften myself and enjoy the training. But you know, the start wasn't so easy. It was very complex. The subject itself was very complex. The weather was not helping. The number of books to read were neither helping. But so far, it feels like playing a game where you won the first leg. You know, when you have two games and you win the first one, you are very confident in the second leg. So that's kind of feeling I have today. It may sound very exaggerating, but the reality is, you know, it brings very unique feeling to be trained of one of the world's best in a subject that is of your heart. It's pathology has been my area of interest for so many years. Opportunities never flew on my way until last October. So now I'm here enjoying the training.
You know, it's super exciting for us as well, honestly, because what we'll now have when Noel, you finish your training here in the States this year and go back to the region, you're going to serve as our regional veterinary pathologist. So for the first time, we'll have somebody in the region, boots on the ground, who will be able to do the really challenging but extremely important work of doing our very best to figure out why sometimes we lose gorillas. So obviously, anytime a gorilla dies in the forest, we're doing a complete necropsy and collecting as much data as we can. I think, you know, that's what makes me super excited about what you're doing here, because you're going to bring not only the pathology training that you're gaining here, but that background and of tremendous gorilla medicine expertise and all of your experience in the field. And so when you go back, how do you anticipate combining that, bringing all of your field veterinary medicine experience to your new responsibility, which will be to really help us quickly and fully and accurately diagnose diseases in the mountain gorilla populations?
What, you know what? That should be the question to you, not to me. Yeah, because
I'm not the boss, you're the boss.
Well, but the reason is, as you said, I don't know which number I'm going to be wearing when I go back. But what I know is that I'll have more skills in veterinary pathology and anatomic and clinical pathology. So, but maybe for just the audience, otherwise I don't know how I will play. You know how I will play, but for the audience, as you might know, Gorilla Doctors is a non-government or a non-profit organization that we are mandated to provide hands-on healthcare to the eastern wild gorillas, the wild eastern gorillas. So it means our veterinarians receive calls about sick or injured gorillas, and then we are out there to do a clinical assessment, which will result into a close monitoring, a partial clinical intervention, or a full physical examination plus medication and anesthesia. Or on a sudden day, we lose one, then we perform a gross post-mortem report post-mortem examination, we do the report. The reason I mentioned the report is, yeah, we produce a report, but until that moment, all you have is what we call presumption. So you don't know. I mean, you have an idea what kind of disease this can be, but until the pathologist look at the slide and comes up with a say or a word or a laboratory report. But this also comes in two ways. There's predicted, you know, when you're looking at the tissue, you might have an idea of what kind of disease you're looking for, but all the time they're most unpredicted stuff. So you get to see something that you were not prepared to see. And all that helps us make clinical decisions. So when I go back, if you give me the right number to put on my shirt, so when I go back, I'll try to help my teammates understand. Well, I should be telling you, well, I should be also mentioning what the pathology is, because pathology is a science that looks after studying and diagnosing diseases. It's a science that was there before our civilization. So if you look at the books many years back, you find it as study of suffering or experiences. And if you look at very new books today where pathologists are sort of selling themselves, you realize they say pathology is the bridge of medicine to other health subjects or disciplines. Yeah. So that's that when I go back with these skills, I'll be helping my team understand the dynamic, the patterns and dynamics of diseases among our patients. Then from there, we'll be deciding what clinical decision to take, what information to give to the park management so that they can strategize, or what contingency plans do we have to make, whether it's a disease that has an effect on one animal, the family, or the entire population. So, and I think that will help us upgrade our working. But the only difference, I mean, we've been using pathology tools since the Guerra Doctors was established, but the way of doing it has been very challenging. And today, when I finish, I'm gonna be, as you said, I'm gonna be the first person with the skills on ground. That means we'll be more accurate and more timely. Yeah, that's what I think.
So thank you, Noel. And you can tell that Noel is incredibly passionate about the work. Lots of, but apparently your elbows on the table are making the camera shake. So our poor audience is bouncing all around us. So we'll keep our elbows off the table going forward. But thanks, Noel. No, it's okay. So I think the other opportunity that your training brings to us is the fact that you will be able to help us directly address this One Health issue we have around the gorillas. I mean, we've talked about this before. For those of you that have joined us for Gorilla Doctors Live events, you know that gorillas and people are very closely related from a genetic standpoint. So gorillas are susceptible to diseases, infectious diseases that affect people. So that's, again, back to that One Health approach, the ability to quickly and accurately diagnose illness in the gorillas is really key to not only recognizing that One Health aspect of our work, but applying One Health tools, right? We are people and we're in the forest taking care of these animals, and we can be making decisions about their management. So yeah, I appreciate that, Noel, and it's great to have you here. We've been really committed to building the capacity of our entire staff all over the world, here and over in Africa for many years.
Yeah, so I'll just add, one of the things that was really exciting for me when I first joined, and it was a bit of a surprise actually, was that you guys had a laboratory very much underway, so that it'll be perfectly, hopefully, prepared by the time Dr. Noel goes back with all of his new pathology training. So I get the kind of fun job of trying to help it just cross the finish line after all the hard work you guys have put into that. So being able to prepare tissues and examine tissues right there, so close to the forest for each case, will be a real advance.
We're ready for the harder part though, because it's get harder and harder. So
Noel's here. We've got a couple of our staff vets also they have some opportunities coming up for them for further training, right?
Yeah, I'm really excited. Dr. Gaspard is going to be headed out here in the early part of 2024 to spend some time on clinical training at the California National Primate Research Center. That's a really nice connection between UC Davis and the Primate Research Center. So he'll be headed out this way as soon as Noel heads back to Rwanda. And then we have some important presentations coming up at the International Primatological Society. So Drs. Ricky and Gaspard are going to be joining me in Malaysia, actually, for some talks.
Very cool. Yeah, so I think all of this speaks to the importance of partnerships. Obviously, here at the Wildlife Health Center is a key partner of the Mountain Gorilla Veterinary Project. We've got a huge commitment to this capacity strengthening, capacity building, but we're not the only ones. And I just want to take a moment to acknowledge an important partner of the gorilla doctors, and that's the Houston Zoo. Houston Zoo and my predecessor, Mike Cranfield, when he was director, we all came together to create some really unprecedented opportunities for our staff for masters in science degree training, as well as hands-on training, clinical training at the zoo. It's been a wonderful partnership. And I just want to take a moment to acknowledge that we, to honor Peter Rieger, a dear friend of ours. He served on the Gorilla Doctors Board and was the Vice President for Conservation and Education at the Houston Zoo. We lost him recently to cancer. He was a very fierce and incredibly successful champion for wildlife and conservation around the world, and always put people first. I think that was really the unique perspective he brought to everything that he did. So I just want to take a moment to honor the tremendous legacy.
Well, thank you. Peter is just a unique personality or kind of leader that embodies all characteristics of a leader that the world would need, especially in the conservation space. He's not just an inspirer. His way of thinking of people and the ecosystem as a whole, it's very unique. And in fact, when you think about him, you feel more like life is unfair, but at the same time, you feel like he's got his part. So it's our turn now to do the job. So it gives me the power of carrying that right in our conservation work. So
could not have said it better myself. Thanks, Noel. Thanks, audience, for letting us have that moment of remembrance.
Yeah.
So Tiara, we touched briefly at the start of this conversation about our science strategy as gorilla doctors, and I know you've been working hard with our entire team to develop a plan for the science that we want to move forward, and I would love for you to share more about that.
Yeah, so kind of what came out of our workshop together in the region was trying to come up with the main themes that we want to be focused on as an organization, because all of these veterinarians have really important jobs treating individual cases. And so when we choose to devote a lot of energy to a specific science topic, it's a long-term game. And so we want to really think carefully about it and make sure we're picking the right areas. So sort of we kind of landed on 4 main themes together during the workshop. And one, of course, is evidence-based clinical research. So we need to make sure that we are continually improving our everyday activities, our procedures, our protocols, and really no one in the world has the data and has the experience that our veterinarians have for clinical-based research in the forest, because we're kind of the only ones really doing it. So we have a lot of projects related to improving things in that realm, and particularly staying abreast of the most recent advances in human medicine. So we're in kind of an exponential phase of growth in human technology and human medicine. I think partly from the pandemic and being forced to really think creatively and quickly. So for example, I'd like to see in the next 5 years us having breath tests for gorillas. That's something that's going to be available for humans really soon. And I want to be able to adapt that to take that to the forest.
Yeah, and I don't want to get you off track, but that's exactly this. That's One Health, right? That's taking tools and processes that have been developed for use in people to great effect. We wild, and like you said, we're in a very unique position really to check on the health of these animals. So that's really exciting. I would love the idea of just putting out some, I don't know, some sniffer thing and getting some air that's been breathed out by a gorilla and knowing what's going on with that gorilla. That would be amazing.
Yeah, exactly. So we have our eyes set on some of those, more futuristic techniques. And then, we have a ton of historical data. So infectious diseases, we know that is going to continue to impact the gorillas, potentially more so than it has in the past. But we can learn a lot from history. And so going back to our archive samples and looking at patterns.
40 years of it.
40 years, yeah, exactly. So it's very rare to be able to come into a new job and a new organization and for people to say, here's 40 years of data.
Yeah,
so
and I would say unique
really
in the wildlife world. I mean, there are very few populations of wild animals in the world where individuals are known and have been tracked over their lifetimes and have had at various times, interventions where we've observed and recorded incidences of illness or injury, in some cases clinically intervened, and all of that data is just, it's an invaluable data set, really.
Yeah, I think not only for that, because archival data are very helpful in all life sectors. Maybe if I take an example of our case, things sometimes are very new. As I remember, we lost a silverback called Noel, I think it was back in 2015.
Noel, his name Noel?
Well, yeah, what's his name? Noel.
Name for you?
Well, coincidence. It was named Noel from...
Maybe your mom named you after the gorilla.
Well, I'm too old. Yeah, but he was from Rugendo Group in BRC. So he had a psoriasis that starts from the back to the right ankle. And he unfortunately died. But from that experience, we were able to already detect similar infection to one of the female in Rwanda, and we were able to treat on time, and she recovered very well. So it means that the long-term data are not only for useful for other cases, you can still use in the same institution.
Yeah.
So very helpful.
Yeah.
So thank you.
Yeah. And sorry, I didn't mean to get you off track. So evidence-based, best achievable evidence-based clinical medicine, continuing our infectious disease research.
Yeah, and diving more into non-infectious disease research. So talking about the historical data we have, there's so much comparative evidence we can use to look at conditions that affect gorillas, but also other great apes, including humans. So that's something we really want to get more involved with. And
yeah, I think sometimes we really focus on the infectious disease because, of course, it's of concern almost always, right? I mean, if it's not COVID, it's Ebola, and then, there are a lot of infectious diseases that we worry about with the gorillas. But like you said, let's not ignore the non-infectious causes of illness, and certainly have a lot to learn there.
Yeah, exactly. And I think the three categories I've mentioned so far are really focused on what's impacting the gorillas right now and how can we make sure they're the healthiest population they can be. But we also want to be forward thinking. So sort of our last category was how can we be involved in predicting based on all of these big changes we know are going to happen in the region and in the world, climate change and biodiversity loss and changes around the park, new roads, new infrastructure. How are those going to change what's impacting the gorillas, and how can we best prepare and be ready when that happens? So thinking about today, but also tomorrow is going to be the focus of our research.
Excellent. Well, we're excited about it. I feel like, we've already embarked on this, the strategy, right? You jumped in right away. We developed a plan, really in close collaboration and conversation discussion with our team, and already have a lot of different avenues underway. It's a really exciting time for us. Cool. So I wanted to also touch a little bit on the fact that we talked a little bit earlier about the fact that we are sitting on this enormous amount of data, and just the way that data is collected. Noel, you touched on how Much of our work is done in the forest where we're observing gorillas, but we have an opportunity now to expand the samples that we collect, even when we're not getting our hands on gorilla patients. And I think that's really, that's definitely a huge aspect of our future surveillance work, because that will allow us to collect a lot more samples from more animals, right? Don't have to rely on just, an intervention, clinical intervention to collect blood or whatever, or swabs, oral swabs. We can be collecting saliva when gorillas have been chewing on plants and dropping the plants. So it's again, just an exciting time to be embarking on really pushing our science forward.
Yeah, I think that advanced technology is helping us do, nobody would think of collecting fecal sample and getting a virus in the fecal sample using the molecular techniques, but it wasn't the case last 25 years, but now it's a possibility. So that gives chances of us to understand science more without putting animals on danger of anesthesia.
Yeah. We often talk about, around here anyway, we talk about the fact that science is really a team effort. We don't do any of the work that we do without a collaborative approach. And I wondered if you wanted to comment on that. What does that mean for gorilla doctors, especially from your vantage point as Chief Veterinary Scientific Officer?
Yeah, I mean, just starting in this position and just seeing how all our 3 teams work together in the 3 different countries, and then coming together and sharing ideas and sharing information about different cases and science that they want to work on, but then also all of the conservation partners that we work with in each country that are absolutely critical to the work that we do, and especially interventions. Maybe thinking about, like, how many people on an intervention are you working with?
Well,
that's quite a lot.
We say that it takes a village to
yeah
it's the whole village, but I appreciate the work of conservation partners, government partners. It's a teamwork, because you just come up, people will say, oh, you did very well, but if you didn't have those people, you'll not be able to do the work. So our collaborative strategic collaboration with the governments, international communities, and individuals who are very committed to conservation, it's been the key to be where we are today.
Yeah. I realized we probably didn't acknowledge or mention earlier in this conversation, but of course, Noel lives and works in Rwanda, but Gorilla Doctors works in Uganda, with almost half of the world's mountain gorillas live in windy impenetrable national parks. We work in Uganda, and we also work in Eastern Congo. And in Eastern Congo, of course, we don't work just with mountain gorillas, but also with their very close cousins, the Growers gorillas. And there's a population of habituated Growers gorillas living in Kahuzi-Biega National Park. And we have a staff veterinarian, Dr. Lena, who I believe was one of our featured guests for the last Gorilla Doctors Live event we held. So yeah, we're working in all 3 countries. We're fairly, I would call us a fairly small team over here in the US, but we have an amazing group of veterinarians and technicians and administrative staff over in those 3 countries, working in the entire range of the Eastern gorilla. So I'm excited about that.
No, we work with the entire world. It's not just
sorry.
Well, because our collaborators and supporters are from all over the world.
It's true.
So
it's true. Yeah.
if you say 3 countries, I'm like, no.
Yeah, no, very good point. And honestly, those of you who've joined us today, you're collaborators too. You're incredibly important to the work that we do. And I want to now kind of turn the conversation over to you. We're here to answer your questions. That was really the intent of this hour. And we've been doing a lot of talking and drinking well, it's not coffee, it's tea. But we'd love to hear your questions. So I've got the Q&A box open on my other screen, and we'll do our best to answer as many of your questions as we can. So forgive me, I got to put my glasses on. Okay, here's a good question. This is from Teresa Nelson. Teresa, I don't know where you're from, but she would like to know how the population is doing now compared to 20 years ago, despite everything that's gone on in the region, wars, habitat loss, et cetera. How are mountain gorillas doing in the wild? Do you want to give that?
Well, thank you. I think good question for not for us, but for the entire audience. Yeah. If you read, you will find that gorillas are the only population of great apes that is growing at almost 4% every year, and it's a very tremendous positive changes from when we started back 1986. So it means that we have at least 4% annual increase. And we are not only thinking of Rwanda or Congo or Uganda, we're just looking at the population as a whole.
Yeah. I mean, I think, so I always say this, it's one of my favorite things to say anytime I'm talking to anybody, but it's really a privilege to be working on a species for which the conservation story is a success. I mean, mountain gorillas are the only great ape whose numbers in the wild are increasing, and that's really the result of the collective collaborative efforts we mentioned earlier. But veterinary medicine is a significant contributor to the annual growth rate of gorillas.
It's about 50%, right?
Yeah, half of the annual growth rate can be attributed to veterinary care. So that's something we're really proud of. And again, it's just a privilege to work on a conservation success story. So the number now is 1,000, and official number of mountain gorillas in the world is 1,063. And every time there's a census, either in the Virungas or in Bwindi Impenetrable National Park, the number just keeps going up.
You've got 604 in the Virunga Massif and 459 in the Bwindi.
Yeah.
So in total, it's
So I have a good question from Kristen Halverson. She was wondering if any of the information that we have around upper respiratory infections, is that something that we are worried about, and what are the protocols we use to protect gorillas from respiratory infection?
Oh yeah, very much worried about respiratory infection, and in fact, it's a second leading cause of death in the population. So even our simple cold is a disaster when you get to the gorillas, because they're very social. The groups overlap very often. It's very easy for respiratory infection to spread through the family and different groups. So now for the prevention, so we talk to the governments, and we use masks, and they have to keep distances. It's now 10 meters from how many feet now?
10 meters is roughly 30 feet.
Okay, 10 meters. Yeah, 10 meters, and just to make sure that people are, especially the visitors, are within the protocol and rules and regulations that are set to make sure that people, as much as we can, we prevent any spillover from human to the gorillas. And in fact, with our laboratory work, we found human viruses being associated with gorilla death. So we have so much precaution when it comes to respiratory infection.
Yeah, and I'll just add that with the new laboratory techniques we have coming on board, we're going to be able to have respiratory panels at the ready, where we can test by PCR for exactly what is in each population. So we'll have more information at the ready sooner.
Yeah, in some ways, the COVID pandemic had some silver linings for gorilla doctors and for gorilla conservation, because all of the practices we adopted globally for protecting ourselves from the SARS-CoV-2 virus were protocols that we could put in place for the gorillas to really do our best to protect them. So, using masks is now required anytime people are close to the gorillas. The distance rule is one that everyone does their very best to enforce. Of course, the gorillas have minds of their own and move around as they please. But with people wearing masks when they're close to the gorillas, we just really, really, really reduce the risk of infectious disease transmission to the animals. And in fact, we looked at the number of respiratory outbreaks that occurred in the gorillas in Volcanoes National Park in Rwanda prior in the 5 years leading up to the pandemic. And when we looked at how many respiratory disease outbreaks were occurring in the gorillas in Volcanoes National Park, once the pandemic started, there were actually fewer outbreaks. So the gorillas actually, as a population, were healthier during the pandemic than they were before. And we attribute that to the fact that certainly in the early part of the pandemic, far fewer people were going to the park, but also when people were in the park, they were wearing masks. So Tara, I have a question for you from Carla Nova. She's asking about vaccines and do we use vaccines in the gorillas? And yeah, maybe you could answer that question. It's a good one.
Yeah, that is a good one and something we are prepared for in the event. We do not currently. They are a wild population, and it's an important line that we think about a lot in terms of how much do we intervene in an entirely wild population. We provide veterinary care if there is a life-threatening event or a human-induced reason to intervene, but we also want them to be a wild population. So we do a lot of thinking about contingency plans if there were to be an outbreak of something really scary like Ebola or other pathogens. We want to be prepared for that, but we also want to make sure that they're a wild population and we're not stepping too far.
Yeah, the issue of vaccinating wildlife is a complicated one across the board, and certainly where vaccinating free-ranging wildlife has been used has been in situations where wildlife pose a health threat to people. So the use of oral rabies vaccines in wildlife to bring down the amount of rabies virus circulating in wildlife so that there are fewer risks to humans, fewer human cases. We all work together with our collaborators at Smithsonian Institution to use a computer predictive model on a computer to see what would happen. First of all, what would happen if Ebola virus got into the gorillas, but then what might our options be for saving as many gorillas' lives as we could. And again, that was a computer simulation, but when we if we introduce the idea of vaccinating at least some of the gorillas for Ebola virus, the survival rate went up. So I think that's just, it's going to open the door to conversations in the future. I think, gorillas have lived forever in an Ebola endemic area. So, we have absolutely zero evidence to suggest that the mountain gorillas have ever been affected by the virus. But now we know that if there happened to be a spillover event into that population, that we have some options to consider and discuss with our partners.
Yeah.
So great. Okay, I'm going back to our list of questions here. Let's see. Yeah. So this is a question from Zachary Jacobson. I'm going to pose it to you, Noel. Diseases that are common or of most concern for gorillas. So going back to your 11 years as a field veterinarian, what were the kinds of issues that would prompt you or require you and our team to go into the forest and check on gorillas? What are the kinds of things that cause injury? And
when you talk about when you talk about disease, the number one cause of death, as I said, is mostly trauma. So, and we do not respond to all kind of traumas. So, and the reason the number is really high is they have their social behavior that if a new silverback comes in, will kill babies below 3 years old, then that will increase the number of mortality. But in terms of respiratory infections, we are very concerned about, we've had the paramyxoviruses. So these are, we have two viruses that are responsible for, especially in sub-Saharan Africa, that kids below 5 years old, if they escape the 5 years, they'll be out of respiratory syncytial virus and the human pneumovirus. And these two viruses we can't isolate them from the gorilla samples. Yeah. Then there are influenzas. There have been serology that told us that they are being exposed to influenzas. And so our worry is every time they suffer from that is, it comes in our category, what we call life-threatening, is that we quickly respond to it and then we take samples to figure out what the virus was. That's how we came up identifying those two. So they also have adenoviruses, but 7 types of adenoviruses. But the literature tells us that about 30% of the gorilla population can have infection of adenovirus and they will do well. And of course, when they get another infection, there might be complication, but otherwise, a population of 30% infection will still do well. Then there'll be very individual or non-communicable diseases like gastrointestinal issues, where we had severe gastritis among the silverbacks, or you have abscesses. I was looking on the tissue last week, on the tissue I'm studying here. So we've also had heart problems, which is weird. Heart problems and some tumors. There's all kinds of disease that you can imagine in a human population to the gorillas.
And maybe I was distracted because I was just looking at all the questions pouring in, but did you mention that, we got started as gorilla doctors because of the issue of snares in the forest and gorillas getting caught in snares. We're still intervening on behalf of gorillas to remove snares from arms and legs. And so that's continues to be a major source of injury that we have to deal with. We had a question from Chris in San Jose, wondering if you were going to be able to work regionally in the other countries as our pathologist.
Well, we are an international team.
Yes.
Well, yes, we have possibilities. It's not even a possibility. The fact is, when I start with gorilla doctors, I used to be crossing the border to Congo and Uganda to work with Fred and AD. So yeah, it's been a no issue. Of course, we sometimes get complication when it comes to the politics, but generally everyone understands the kind of work we're doing and everyone appreciates. So yes, my role is gonna be, did you say what? Well, I'll be doing all gorilla samples from all 3 countries. So I don't know what side is gonna be, she knows.
Thanks. A question from Calvin Wolf in Colorado. He said he remembers Dr. Jan Raymer when she first arrived on the scene in Rwanda, and she started a blog that got bigger and bigger, but wanted us to talk a little bit about the history and growth of gorilla doctors. And I think maybe it's just a good opportunity to remind everyone that we've been doing our work for 40 years. We really got started at the request of Diane Fossey, who was concerned about the number of her animals that she was studying that were getting caught in snares. And so gorilla doctors started in 1986, a single veterinarian, American veterinarian hired to come over to the region and take care of gorillas, specifically remove snares under anesthesia, which is why a veterinarian is needed. And we've grown to become, as Noel pointed out, an international team of Rwandan, Ugandan, and Congolese veterinarians working in all 3 countries. So I think that is really reflects the tremendous investment made by many individuals and the leadership of my predecessor, Mike Cranfield, and really making sure that we were a team that was addressing all aspects of gorilla health, not just the emergencies, but also doing what we could to prevent the introduction of disease to the population. So that remains really core to our mission. But yeah, we've changed a lot in 40 years.
But you're forgetting other people.
Forgetting our people.
Other people. You say Ugandan, Congolese, Rwandans.
Yes.
Yeah, we had Americans, we had Europeans. We have a list of veterinarians who have gone through our team. And by the way, Jenny Raymer is back as a board member, right?
Sorry.
Jenny Raymer is back.
That's true.
Board
Jan
member.
Raymer is still with
still
us.
the team.
Yeah, you're right. We have a question from Sheila Smith, all the way over there in London. And she's not the only one that has asked a question about kind of what do we do with local communities and local people. Do you want to talk a little bit about the work you've done with, like, for example, Bwindi Community Hospital in Uganda, just to better understand what's going on in the communities around these parks?
Yeah, that's a good question, and really core to our One Health mission. It's a part of our science for gorilla doctors, and that if we don't have healthy populations around the park, we're likely not going to have healthy gorillas either. So part of our research is also focused on understanding causes of acute febrile illness in people that live right on that really, really, really close border of the park and surrounding communities. So I think some of the work that we've done has been in collaboration with the Bwindi Community Hospital, which is a really excellent hospital right on the edge of the Bwindi Impenetrable Forest. And they have a pretty unique system of satellite clinics that go around the park. So we're able to get a big grasp of people that we can look at. And I think some of the interesting work that's come out of that research has been, just the importance of respiratory viruses in people and understanding the trends in that, and also exposure to other pathogens, including Ebola viruses that happen around the area involved with hunting. So yeah, that's a big part of our work as well.
I think some of the other ways too, I know, Noel, you've spent a lot of time going into classrooms and talking about what you do as a veterinarian for gorilla doctors, but also the importance of just good practices around protecting one's own health, good hygiene, and also helping kids of all ages understand, the link between themselves and their communities and their practices and the health of the gorillas.
Well, yeah, yes, and I think what I think the question would be is, how are we involving the community to be the owner of this conservation effort?
Mm-hmm.
And that's the best way of doing that is what you mentioned. We just go with the primary school kids. It's awareness issue. So do they know what is around them? Do they feel responsibility of protecting them? Do they feel their own health matters? So then from there, I mean, if I do an evaluation from my interaction with kids, I'm very confident that next 10, 20 years, we'll have a big team of conservationists doing the work. So, and that's what, to me, that's what matters, is that do they understand it? And do they see their responsibilities now on?
Yeah. I think the other thing we've put a lot of time and energy and effort into is creating occupational health opportunities for park workers. So we've spent a lot of time with the park personnel and their family. Of course, park personnel are members of the communities around the parks, and so we've done a lot to just make sure that they're getting the best possible preventive care from physicians, and in fact have also worked with Volcanoes National Park to hire a park doctor. So there's now a park doctor whose sole patient population are the individuals who work in the parks and their immediate family members. So yeah, a lot of different ways that we as gorilla doctors are working with communities around the parks, both from a surveillance standpoint and a capacity building and education standpoint, and health, just basic health. Tiara, I've got a question for you from Rick 7. He asks if there are any similar programs devoted to other threatened great apes, in particular gibbons and orangutans. So I'm asking you because I know you've spent quite a bit of time studying small apes in Southeast Asia, but can you comment on whether there are any similar programs like gorilla doctors for other great apes?
That's a good question. Thinking about the gibbons, because we were trying to see if we could do some comparative studies between gibbons and gorillas, and I was pretty excited about that, but it was challenging because there's definitely not a comparative group that's doing the level of pathology that Gorilla Doctors is doing. So when we were looking at our sample sets of what we had for gorillas, we couldn't really come up with anything matched for that. So I think for those species that I've worked with in Southeast Asia, it's more monitoring and there's much less habituation than there is for. So
I mean, that's key,
possible.
right?
Yeah.
The reason we can do our work is mountain gorillas, a huge portion of the entire world's population is human habituated. It means we can get close enough to them to observe them for signs of illness or injury and actually do something about that. So it is a very unique situation that's really unparalleled in the world. There is no other program quite like ours, where the veterinarians are going into the forests where the great apes live and administering life-saving care that's making a difference for the population. It's pretty unique, which is what, I don't know about you guys, but that's what keeps me going for sure.
Yeah.
But I think they will debate, I don't know how far they are, but they will debate of having a universal biobank where people will have access to different samples of different species. So that will be another way of collaboration or duplicating what is being done on one side to the other side.
Yeah. Let's see. There's so many questions here. Here's a good question it's for you.
Cool.
This is from Tatiana Corey, who's also a primate veterinarian. She's asking, how do we balance the decision for intervention versus just monitoring clinical signs? What it goes into our decisions to clinically intervene in the forest?
Well, it's pretty straightforward in our case because we are driven. Well, as you can imagine, working with these animals for so many years, people will develop some kind of emotions or bond. So for us to be aware of it is to be guided by our strategic and protocols. So we only do clinical intervention when we know it's a human-induced issue, like snares or infection we suspect coming from humans, or when is anything that from our clinical assessment, we believe that if we do not take medical action, the animal is going to die. So we are very convinced of that. So otherwise, I mentioned about monitoring is that, yeah, the animal is moderately sick, but doesn't mean that it's going to die. So then, given that it's a wild animal, I need to give him a chance to fight the infection on his own. If he's not making it, and then we'll go to what we call worst scenarios, then I will come up with medication. That's only circumstances we provide clinical support. So otherwise, it's just about visual health assessment and making sure that we see everyone every day to make sure they're healthy. Yeah.
Yeah, I think, thanks, Noel. I think it's important we always remind ourselves that we're not trying to play Mother Nature. We're really trying to intervene when there is significant life-threatening illness or injury that was or may have been caused by the fact that gorillas come close to humans. And so a lot of the time we're letting nature take its course and watching animals, you know, their wounds heal or their illness resolve. But it's really those decisions to clinically intervene with medication or to anesthetize a gorilla in the forest and treat it are not made lightly. And they are always made in very, very close collaboration, coordination with our park partners, of course. The parks are managing the gorillas for the world, and we're part of that. So I'm watching the time here. We're getting close to the end. I'm gonna let's take one more question, and I'm actually going to pose it. Let's each answer as we can. Okay. This one is from Judy Stampler. She would love to hear what we see as the 3 to 5 year roadmap for gorilla doctors. So you as Chief Veterinary Scientific Officer, what do you see us accomplishing in the next 3 to 5 years? Where will that take us?
That is a good question. And we've been spending a lot of time thinking about exactly that. So of course, our first and foremost mission is treating the gorillas and making sure we have a healthy gorilla population. So making sure our clinical operations are moving as smoothly as possible is a #1 top goal. But I'm going to put in some of our science goals. So we definitely want to see our veterinarians publishing more and more manuscripts. We have just such a wealth of information that is really just in our group's, you know, brain trust right now. And we want to get that out into the scientific community through papers, through hopefully a clinical medicine book that brings together everyone. And in 3 to 5 years, I'd like to see more and more available to all of you to read that for your interest.
Nice, thanks. Noel.
Well, next year, I mean, for 3 years, just to be in line with the question, for 3 years, looking at gorilla doctors who have very strong functional regional laboratory that can do in-house testing, pathology, and molecular testings. Then our goal is really to reach a point where this population can self-sustain. So there are multiple factors around, but when I see the next 5 years, given their dynamic and the strength of the team, I feel like when they do another census, maybe we shall review what's new in a protocol moving towards that main goal.
Yeah. Okay. Yes. And I would say that in 3 to 5 years, I hope and intend to see that our organization could not be stronger from the standpoint of the individuals working for the organization in all aspects of our operations, and really always striving for our sustainability and strength as an organization. And really, it's a great opportunity for me to thank all of you who've joined us today. Many of you support us, and I just want to thank you, donors, for your support. We are actually in the midst of a fiscal year end campaign. So we appreciate your support and considering making a gift at this time of year. Thank you so much. I think with that, we probably need to let you go shortly. Any parting words from Dr. Tier or Dr. Noel?
That's that.
I'm just going to say thank you for having me to my first GD Live event. I hope to be able to participate in more in the future and get to meet many of you through various avenues.
Thanks, Tiara. Noel?
Well, thank you guys for making the time. It's always a pleasure to talk to the world because I feel like that's the way of reporting. So it's been a very nice morning and enjoy the rest of your day.
Thanks, Noel. He's right. I think we've had people from all over the world join today, which is just incredibly heartwarming and much appreciated by all of us. Thank you so much for joining us for this hour of coffee or tea or whatever we were drinking, and for your great questions. We look forward to doing this again soon. So thanks. Enjoy the rest of your day, whether it's an afternoon or evening. We appreciate your time. Thanks very much. Bye.